Ever been to the ER for chest pain? Or maybe you know someone who has. Well, if so, there's one test that doctors pretty much always run right away. It's called the troponin test. So in this explainer, we're going to break down exactly what that is, what the results mean, and why it's such a critical piece of the whole medical puzzle. Okay, so picture this. You're in the hospital, maybe with chest pain, and everything's happening super fast. One of the very first things they do, a blood draw, and they're looking for something called troponin. But what is this stuff, and why is it the very first clue doctors search for when they think there might be a heart emergency going on?
All right, first things first, what is troponin? We're going to uncover the first big clue.
So troponin is basically this protein that's found naturally inside your heart muscle cells. Think of it like a tiny but essential part of the engine that helps your heart contract and pump blood. Now, normally, it just stays put, right inside the heart. The only time it gets out is when those heart muscle cells are damaged or under a ton of stress. That's when it starts to leak out into your bloodstream.
Yeah, a really good way to think about it is like a distress signal from your heart. See, in a healthy person, the amount of troponin floating around in your blood is practically zero. It's almost undetectable. So when doctors suddenly see it pop up in a blood test, they know your heart is sending out a serious SOS, basically shouting that something's wrong.
Okay, so let's get into reading the results. What does a high level of troponin actually mean? Right, so an elevated level definitely points toward heart damage. But, and this is super important, there isn't one single number that counts as high. Nope. Every hospital uses slightly different testing machines, and each one has its own specific cutoff. So what doctors are really looking for is a level that's way above the normal range for their specific lab. So what are the possible causes? This is where the doctors really have to line up all the suspects. Okay, so a heart attack is obviously the big one, the first thing they think about. But it's not the only possibility, not by a long shot. You could have an abnormal heart rhythm that's just making the heart work way too hard, causing it to release some troponin. Or you could have inflammation of the heart muscle itself. That's called myocarditis. And get this, sometimes the problem isn't even in the heart. A really severe infection somewhere else in your body, or even a blood clot in your lung, can put so much stress on the heart that it causes that troponin to leak out.
All right, so why do they need a second test? Let's talk about following the trail of clues. This is so key to understanding what's going on. See, when the heart muscle first gets damaged, the troponin starts to leak out, but it's not instant. It actually takes a few hours for the levels to build up enough in your blood to be easily detected. And after that initial spike, the levels can stay high for several days while your body works to clear it all out.
And that right there is exactly why they do a second test. It's not about just one number. It's all about the trend. Is that number going up? A rising troponin level is a much, much stronger sign of a fresh, ongoing problem like a heart attack than just a single high number that isn't changing. That change over time, that tells the real story. Okay, so let's put it all together and look at the big picture. Look, the troponin test we have today is an amazingly sensitive and useful tool. It's a fantastic starting point for doctors. Because it can pick up even tiny amounts of heart damage, it lets them quickly know, yup, the heart is involved here. And that really helps them figure out what critical steps to take next. But, and this is probably the most important thing to remember, the troponin test is a crucial clue, but it is not the final answer. Doctors have to take that number and combine it with everything else, your symptoms, a physical exam, other tests like an EKG. Think of it as just one really important piece of a much larger medical puzzle. It's a great reminder that even with all our amazing tests, a diagnosis is about seeing the whole person, not just a single number on a lab report.